What if I told you that there's a therapeutic approach that can double your client's success rate, reduce their resistance to change, and actually make them want to engage in treatment? And what if this approach goes against everything you might think you know about helping people change? Today we're diving deep into motivational interviewing, one of the most evidence-based and revolutionary approaches in modern counselling. Whether you're a psychology student, a practicing counsellor, or anyone who wants to help others change, this video will transform how you think about motivation and behaviour change. Welcome to Therapy Hearts, and in this comprehensive guide, we'll cover everything you need to know about MI, from its surprising origins to practical techniques you can use immediately. So grab your notebook because we're about to explore why arguing with people almost never works, and what to do instead. Here's what we'll cover in today's video. Chapter 1. The Surprising Story. Let's start with a story that might surprise you. Picture this. It's the 1980s, and Dr. William Miller is working with people struggling with alcohol addiction. He's using the standard approach of the time, confrontational therapy. You know, the kind where you break down someone's denial and force them to face their problems. But here's the thing, it wasn't working. In fact, Miller noticed something disturbing. The more he argued with his clients, the more they argued back. The more he confronted their denial, the more resistant they became. Then Miller had a revolutionary thought. What if the problem wasn't the client's resistance? What if the problem was his approach? So he tried something radical. Instead of arguing for change, he started listening. Instead of confronting denial, he started exploring ambivalence. Instead of being the expert with all the answers, he became a curious guide helping people find their own reasons to change. The results? Dramatic. Clients who had been labelled resistant suddenly became engaged. People who had failed multiple treatments started succeeding. And thus motivational interviewing was born. Fast forward to today, over 1,000 published studies, applications in dozens of fields, and success rates that consistently outperform traditional approaches. But what exactly makes MI so effective? Chapter 2. The Psychology Behind Change. To understand why MI works, we need to understand something fundamental about human psychology. People don't like being told what to do. There's actually a name for this: psychological reactance. When someone feels their freedom or autonomy is threatened, they automatically push back. It's not conscious, it's hardwired into our brains. So when a counsellor says you need to quit drinking, what's the client's natural response? That's right, all the reasons why they can't quit drinking start flooding their mind. The counsellor has just triggered the client's own defence system. But watch what happens with an MI approach. You mentioned that your drinking is causing some problems. Tell me about that. Now the client is exploring their own concerns, not defending against someone else's agenda. Here's the key insight. When people argue for change themselves, they're far more likely to follow through. It's not enough for them to intellectually understand why they should change. They need to emotionally connect with their own reasons for change. MI calls this change talk, any statement the client makes that favours change. Things like, I want to be healthier, or I need to do something different, or I have the ability to change this. The more change talk a client produces, the more likely they are to actually change. But here's where it gets really interesting. Chapter 3. The 4 Pillars of My Spirit. MI isn't just a collection of techniques. It's a way of being with people. Miller and Rolnick call this the spirit of MI, and it rests on 4 foundational pillars. First, partnership. In traditional therapy, there's often a power imbalance. The therapist is the expert who diagnoses problems and prescribes solutions. In MI, the counsellor and client are partners. The client is the expert on their own life, and the counsellor is a skilled guide. Second, acceptance. This doesn't mean approving of everything the client does. Instead, it means accepting the person's absolute worth, understanding their perspective accurately, affirming their strengths, and supporting their right to choose their own path, even if we disagree with their choices. Third, evocation. Here's a crucial distinction. MI doesn't try to install motivation in people. Instead, it evokes the motivation that's already there. Every person has reasons for change buried inside them. Our job isn't to convince them, it's to help them discover what they already know. Fourth, compassion. Added in the latest edition of the MI book, compassion means actively promoting the client's welfare and prioritizing their needs over our own agenda, even our agenda to help them. When these four elements come together, something magical happens. Clients feel heard, understood, and empowered. They stop defending and start exploring. They move from resistance to engagement. But how does this actually look in practice? Let me show you. Chapter 4. The 𝐸𝐻 Framework. The practical skills of MI are organised around the 𝐸𝐻 framework. Think of these as the oars that help you navigate the conversation toward change. O stands for open-ended questions. These are questions that invite exploration rather than just yes or no answers. Instead of, do you think you drink too much? Try, what concerns you about your drinking? See the difference? The first question puts the client on the defensive. The second invites them to explore their own concerns. Some powerful open-ended questions. What would you like to see change? How would you like things to be different? What worries you about this situation? What would have to happen for you to know it's time to change? A stands for affirmations. These aren't empty praise or false positivity. They're genuine acknowledgements of the client's strengths, efforts, and positive qualities. You've shown real courage in talking about this, or that took strength to recognize, or you clearly care deeply about your family. R stands for reflections, and this is where the magic really happens. Reflections are statements that mirror back what the client has said, showing that you understand. But they're not just parroting. Skilled reflections can guide the conversation. There are different types of reflections. Simple, you're feeling frustrated. Complex, part of you wants to change, and another part is scared of what that might mean. Double-sided, you enjoy the social aspects of drinking, and you're worried about the impact on your health. Feeling reflections, that sounds really overwhelming. S stands for summaries. These are periodic reviews of what you've heard, highlighting key themes and insights. They help organize the conversation and emphasize important change talk. Let me show you how this works in a real conversation. Client: I know I should exercise more, but I'm just so busy with work and kids. I feel guilty about it, but I'm exhausted by the end of the day. Counselor: You're feeling pulled in multiple directions. You recognize the importance of exercise, and you're also managing the reality of being exhausted from your responsibilities with work and family. That sounds really challenging. Client: It is, and I used to be so active in college. Counselor: There was a time when being active was a natural part of your life. What was different then? Client: I had more time, more energy, and I felt better about myself when I was active. Counselor: Being active gave you more than just physical benefits. It affected how you felt about yourself too. That sounds important to you? Did you catch what happened there? The counsellor didn't give advice, didn't lecture about the benefits of exercise, didn't try to solve the time management problem. Instead, they used OARs to help the client explore her own motivations and connect with what matters to her. Chapter 5. The Stages of Change. Now, one of the most powerful aspects of MI is how it integrates with the stages of change model. Understanding where your client is in their change journey completely transforms how you approach the conversation. Let's start with pre-contemplation. This is someone who isn't even considering change. Maybe they don't see a problem, or they've given up hope that change is possible. The traditional approach? You need to face reality. You have a serious problem. What happens? Resistance. Defensiveness. The client digs in deeper. The MI approach? Help me understand what brings you here today, given that you're not sure there's a problem. Now you're genuinely curious about their perspective, not trying to convince them they're wrong. Next is contemplation. This person is aware there might be a problem and is considering change, but they're ambivalent. Part of them wants to change, part of them doesn't. Traditional approach. You've been thinking about this long enough. It's time to make a decision. Result? The person feels pressured and may retreat back to pre-contemplation. MI approach. Part of you sees reasons to change, and part of you has concerns about changing. Tell me about both sides. Now you're helping them work through their ambivalence rather than ignoring it. Preparation stage is someone who's decided to change and is making plans. Here you can start offering resources and helping them think through practical steps. Action stage is when they're actively changing their behaviour. Your role shifts to supporting and troubleshooting. Finally, maintenance is about sustaining change over time and preventing relapse. Let me give you a real example. Sarah comes to counselling because her mum thinks she has anxiety. She says, everyone gets stressed in college. This is normal. What stage is she in? That's right, pre-contemplation. She doesn't see a problem. So what do we not do? We don't argue with her. We don't educate her about anxiety disorders. We don't try to convince her she needs treatment. Instead, we might say, your mum is concerned, and from your perspective, what you're experiencing feels pretty normal. I'm curious. What would need to be different for you to feel like our meetings might be helpful? See how we're respecting her perspective while gently exploring what might motivate her. Now let's talk about where MI is being used, because the applications go far beyond addiction treatment. Healthcare is huge. Imagine you're a doctor and your patient with diabetes isn't taking their medication. Traditional approach. You need to take your medication or your diabetes will get worse. How do you think that lands? MI approach. I noticed your last A1C was higher than we'd like. What's your understanding of how the medication helps? Then you explore their concerns, barriers and motivations. The results speak for themselves. Better medication adherence, improved health outcomes, higher patient satisfaction. Education is another major area. Instead of punitive approaches to behavioural problems, schools are using MI to understand what's driving the behaviour and help students find their own motivation to change. Criminal justice systems are using MI with probation officers and in drug courts. Instead of just enforcing compliance, they're helping people find internal motivation for positive change. Mental health applications are expanding rapidly. MI is particularly effective with adolescents because it respects their developmental need for autonomy. Let me share a quick case study. Jake, 16, was caught smoking marijuana at school and is required to attend counselling. He starts with, "This is stupid, I'm not a drug addict." Everyone smokes weed. What's your first instinct? To educate him about marijuana's risks? To challenge his minimisation? To explain why he needs to take this seriously? All of those responses would increase his resistance. Instead, the counsellor reflects. You don't see yourself as having a serious problem, and being required to be here feels unfair. Jake responds, "Exactly. It's not like I'm using hard drugs or anything." Counsellor, you make a distinction between marijuana and other substances. What matters to you about that difference? Notice how the counsellor isn't arguing with Jake's perspective. They're exploring it. This opens up conversation instead of shutting it down. Chapter 7. The Science Behind MI. Let's talk about the evidence, because MI isn't just a feel-good approach. It's one of the most rigorously researched therapeutic methods available. The numbers are staggering. Over 1,000 published studies, more than 200 randomized controlled trials, over 50 meta-analyses. Applications studied in more than 30 different conditions. In research terms, MI consistently shows small to medium effect sizes, which means it produces meaningful, measurable changes in people's behaviour. But here's what's really fascinating. Researchers have identified the specific mechanisms that make MI work. First mechanism, change talk. Studies show that the amount of change talk clients produce in MI sessions directly predicts their success. The more they talk themselves into change, the more likely they are to follow through. Second mechanism, therapeutic alliance. The collaborative, non-confrontational style of MI builds stronger relationships between counsellors and clients. And we know that the quality of the therapeutic relationship is one of the strongest predictors of success in any therapy. Third mechanism, self-efficacy. MI enhances people's confidence in their ability to change by affirming their strengths and supporting their autonomy. When people believe they can change, they're much more likely to try. Fourth mechanism, reduced resistance. By rolling with resistance instead of fighting it, MI prevents people from becoming entrenched in their defensive positions. When compared to other approaches, MI versus confrontational counselling, significantly better outcomes with lower dropout rates. MI versus educational approaches, superior for behaviour change. MI versus CBT, similar effectiveness, often with briefer intervention time. MI as a pre-treatment enhances engagement in subsequent interventions. A major meta-analysis found an overall effect size of 0.28. That might not sound huge, but in therapy research, that's considered a meaningful effect. And here's something interesting. MI showed larger effects for ethnic minorities and worked better when delivered by non-specialist counsellors. But like any approach, MI has limitations. Chapter 8. Common mistakes and how to avoid them. Even with the best intentions, it's easy to fall into traps that undermine the effectiveness of MI. Let me show you the most common mistakes and how to avoid them. The biggest trap? The expert trap. This is when you fall into the role of having all the answers and giving unsolicited advice. Role play, expert trap example. Client: I can't seem to stick to my diet. Expert trap response: you need to plan your meals in advance and remove tempting foods from your house. MI response: sticking to the diet has been challenging. What gets in the way for you? See the difference? The first response assumes I know what's best for you. The second response treats you as the expert on your own experience. Next trap, the righting reflex. This is our natural urge to fix problems and set people straight. It feels helpful, but it often backfires. Signs you've fallen into the righting reflex. Feeling urgent need to convince the client, arguing with the client's perspective, providing multiple reasons why they should change, getting frustrated with client resistance. Another common mistake, the question-answer trap. Some people think MI is just about asking open-ended questions, so they turn sessions into interrogations. The ideal ratio? More reflections than questions. Questions gather information, but reflections build understanding and guide the conversation. Role play. Better balance example. Client: I've tried to quit smoking before, but I always go back to it. Too many questions. When did you try? How long did you last? What methods did you use? What made you start again? Better balance. You've made attempts before, and something brought you back to smoking each time. That must have been discouraging. Reflection first, then maybe one thoughtful question. Premature planning is another big mistake. This is moving to action strategies before the client is really ready for change. Signs a client is ready for planning: strong change talk and commitment language, asking for advice or suggestions, discussing specific change strategies, taking steps toward change between sessions. Don't forget cultural considerations. MI must be adapted to respect different cultural values and communication styles. Finally, remember that MI looks simple but isn't easy. It requires ongoing practice, supervision, and feedback to master. Even experienced counsellors can slip into MI inconsistent behaviours without realising it. My recommendation? Start practicing these skills in everyday conversations. Notice your righting reflex. Pay attention to how people respond when you reflect instead of giving advice. It's amazing how much you can learn just by changing how you communicate with friends and family. Chapter 9. Putting it all together. Let's put everything together with a comprehensive case study that shows MI in action from start to finish. Meet Michael. He's 45, has type 2 diabetes, and his A1C levels are consistently high. His doctor referred him to counselling because he's struggling with diet and exercise recommendations. He's been living with diabetes for 5 years, and he's frustrated with the constant focus on behaviour change. Role play, session beginning. Counsellor: Thanks for coming in, Michael. Your doctor mentioned that managing diabetes has been challenging. What's your experience been like? Michael: Honestly, it's exhausting. Everyone's always telling me what I should eat, how much I should exercise. I try, but I work 50 hours a week, I've got 2 kids, and by the time I get home, I'm just done. Notice what the counsellor did not do. Didn't lecture about the importance of diet and exercise, didn't minimise his challenges, didn't immediately offer solutions. Instead, they expressed empathy and invited him to share his perspective. Counsellor: You're dealing with competing demands, wanting to take care of your health and also managing the realities of a busy work schedule and family responsibilities. That sounds really overwhelming. Michael: It is. And honestly, my dad had diabetes, my grandfather had it. Sometimes I wonder if it matters what I do anyway. Michael just shared something important. He's questioning whether his efforts can make a difference. This is a crucial moment. What would you do? Counsellor: Part of you wonders if your efforts can really make a difference given your family history. What keeps you interested in trying to manage your diabetes despite that concern? Michael: Well, I guess I want to be around for my kids. My dad had a lot of complications from his diabetes, and I don't want my kids to go through what I went through. Did you catch that? The counsellor used a double-sided reflection to acknowledge his doubt while evoking change talk. And it worked. Michael identified his core motivation, being there for his children. Counsellor: Your children are really important to you, and you want to avoid putting them through the worry and difficulty you experienced with your father's health. Tell me more about what being there for them looks like to you. Michael: I want to be able to play with them, go to their games, walk my daughter down the aisle someday. When my dad got sick, everything changed for our family. Counsellor: Those are powerful motivations. You have a clear vision of the kind of father you want to be. Given those goals, where does diabetes management fit in for you? Michael: I know I need to do something. I just don't know how to make it work with everything else going on. Notice the shift? Michael went from questioning whether his efforts matter to saying, I know I need to do something. That's change talk. Now the counsellor can start exploring what's possible. Counsellor: You're committed to being there for your kids, and you recognise that managing your diabetes is part of that. What feels most realistic to you as a first step? Michael: Maybe I could start with something small. Like, I drink a lot of soda during the day. Maybe I could switch to water or something. Counsellor: Switching from soda to water feels manageable to you. What makes that feel like a good place to start? Michael: It's something I can control, and I know it would make a difference. Plus, I wouldn't have to find extra time for it like with exercise. Perfect example of MI in action. The counsellor started with empathy and understanding. Avoided the expert trap. Used reflections to guide the conversation. Evoked change talk by exploring Michael's values. Let Michael identify his own solution. Supported his autonomy in choosing what feels realistic. This is how change happens, not through convincing or educating, but through helping people connect with their own motivations and find their own path forward. Let's wrap up with the key takeaways that will transform your practice. First, remember that you're a partner, not an expert. Your role is to guide the conversation, not provide all the answers. The client is the expert on their own life. Second, evoke, don't install. The motivation for change already exists within your clients. Your job is to help them discover it, not to convince them to change. Third, embrace ambivalence. Mixed feelings about change are normal and natural. Work with ambivalence, not against it. Fourth, master the 𝐷. Open-ended questions, affirmations, reflections and summaries are your navigation tools. Practice them until they become natural. Fifth, match your approach to the client's stage of change. Different stages require different strategies. Sixth, avoid the common traps, the expert trap, the writing reflex, and premature planning. And remember, this isn't just feel-good therapy. MI is backed by over 1,000 studies showing its effectiveness across diverse populations and settings. Here's your homework. Start practicing these skills today. In your next conversation with a friend, family member, or colleague, try reflecting instead of giving advice. Ask an open-ended question instead of a closed one. Notice what happens. For deeper learning, I highly recommend Miller and Rolnick's book, Motivational Interviewing, Helping People Change. It's the definitive guide to this approach. If this video helped you understand MI better, please give it a thumbs up and subscribe for more psychology content. I'd love to hear in the comments, what's one MI technique you're excited to try? Or share a time when someone used an MI approach with you. How did it feel different? Remember, small changes in how we communicate can lead to profound differences in how people respond. You have the power to help others find their own motivation for change, and that's an incredible gift. Thanks for watching, and remember, people don't resist change, they resist being changed. When you honor their autonomy and work as a partner, amazing things become possible.